In this video, I will discuss 3 best supplements that can potentially prevent or reduce the severity of autoimmune diseases. Plus, I will teach you how to select good quality supplements and what are the recommended doses. If you or a loved one is suffering from rheumatoid arthritis, psoriatic arthritis, Sjogren's disease, or even lupus, then this video is for you. Hi, welcome back to my channel. I am Dr. Diana Granita, a rheumatology specialist treating people with autoimmune diseases for more than 15 years. The first supplement is vitamin D. You most likely know that vitamin D helps with your bones. And this is correct. Vitamin D regulates how calcium, magnesium, and phosphate are absorbed in the small intestine and deposited in your bones. However, it was later discovered that vitamin D is more than just a vitamin. It is actually a hormone, and it can also influence your immune system cells. Yes, it appears that a low level of vitamin D in your body was linked to more inflammation and an increased risk to develop autoimmune diseases like Sjogren's disease or rheumatoid arthritis. Now, the opposite. A higher vitamin D level in your blood seems to be protective, and people develop less autoimmune diseases like rheumatoid arthritis, lupus, Sjogren, multiple sclerosis, and even psoriasis or psoriatic arthritis. Actually, a large study, which was published in 2022, showed that people taking a vitamin D supplement decreased their risk to develop autoimmune diseases by 22%. What should you do regarding your vitamin D level? So, if you have a high risk to develop an autoimmune disease, as you have someone in your family that has an autoimmune disease, then talk to your doctor and check your vitamin D level every year. And if your vitamin D level is low, then start supplementing. To reduce the risk of autoimmune diseases, the study that I just mentioned, called VITAL study, proposed to take 2,000 international units every day. If you're interested, I will leave a link in the description of this video for a good quality vitamin D supplement. The second supplement that I want to discuss is fish oil or omega-3 fatty acids. You probably heard about the benefits of fish oil for your heart or to decrease the lipids like cholesterol and triglyceride levels. But have you heard about using fish oil for autoimmune diseases? Fish oil or omega-3s have great anti-inflammatory effect, meaning that they will be able to decrease inflammation in your body. But how is this possible? Fish oil will block an enzyme called COX-2, and this is the same enzyme that NSAIDs like naproxen or ibuprofen are blocking. And in this way, they reduce inflammation and, very important, will reduce the pain. There are many studies in patients with rheumatoid arthritis that will show that using fish oil or omega-3 supplements will decrease the joint pain, will reduce the morning stiffness and the swelling of the joints, and, very important, will decrease or eliminate the need to take more NSAIDs like ibuprofen. One study from 2015 showed that people that took a high dose of fish oil along with a triple DMARD therapy like methotrexate, plaquenil, and sulfasalazine got into remission faster. And this is huge because as a rheumatologist, seeing patients with rheumatoid arthritis every day, if there is a way, more natural way, that I can bridge with the standard therapy that I use to help my patients to use less medication, to use less NSAIDs that you know that can be toxic for your heart and for your kidneys, and to get them into remission faster, I will discuss that with my patients. The same benefits were seen in patients with lupus. So taking omega-3 supplements was helping patients with lupus to have a less aggressive disease. In patients with psoriasis and psoriatic arthritis, fish oil or omega-3 showed to decrease the skin psoriasis, but also decrease the pain from their joints. In patients with Sjogren's disease, the use of fish oil show to improve the dry eyes and dry mouth. Now, what is the recommended dose? The recommended dose is between 2 and 4 grams EPA DHA daily. If you want to improve the absorption, then take the omega-3 supplements with your meals. So other fats that you are eating will help with the gut absorption. One thing that you need to pay attention, some fish oil products may contain mercury. So make sure you get a high quality supplement. And if you are taking other medications like blood thinners, blood pressure medications, or even contraceptive medications, you have to talk to your doctor as there might be some interactions there. Now, right here, we are getting even deeper, and we will discuss about a controversial supplement that many patients are taking to improve their gut health. If you did not know, your gut is in very much contact with your immune system cells. In the last 10 years, there was a lot of conversations related to the gut bacteria that we scientifically call the microbiome. And what is the link with the autoimmune diseases? We clearly see an epidemic of autoimmune diseases, and many researchers believe that the root cause is in the gut, and the changes that are happening with our bacteria are the cause of autoimmune diseases, and we call that dysbiosis. Now, dysbiosis means that for multiple reasons that I will discuss in another video, we lose the beneficial or the good bacteria, and we end up with a large number of potentially harmful or bad bacteria. What is the result? An increased risk to develop autoimmune diseases. So how can we fix the gut bacteria? Many supplement companies propose to take probiotics, which are live organisms, so-called the good bacteria, that come with the promise that will improve your gut health. Many probiotics contain multiple strains of lactobacillus and bifidobacterium. Now, how about taking probiotics in people suffering from an autoimmune disease? In patients with psoriasis that took probiotics for 3 months, they proved to reduce the markers of inflammation, and they helped the skin disease in 70% of those patients. In patients with rheumatoid arthritis, taking probiotics, it also helped to reduce the markers of inflammation and also the symptoms. But don't get too excited, as there are other studies that show that taking probiotics is not beneficial. And there might be explanations for these variable results. Maybe the probiotics that were used had different types of bacteria. Maybe the patients took them for too short of a time. So if you are taking probiotics and you have an autoimmune disease, please share your experience in the comments below. But if you want to try probiotic supplements, here is my recommendation. You have to use a multi-strain product with at least 20 billion colony-forming units. In my upcoming book, Thriving with Rheumatoid Arthritis, I am talking about all these studies and will give you the scientific evidence for all the supplements that you need. Now, this part is very important to listen to because I'm getting this question all the time from my patients. Doc, how do I know that a certain supplement is a good one? So let me teach you how to select a good quality supplement that you need. You have to know that FDA, or the Food and Drug Administration, does not evaluate the effectiveness, the safety, or the quality of supplements, or the ingredients that are in them. That means that there is no guarantee that what supplement companies claim they actually have inside. But here is a smart tactic. First, you have to make sure that you buy supplements from a company that is certified by a third party. These third-party companies will verify the producing supplement company that what they claim there is in that bottle, it's actually there. and the same components and the same doses will remain the same between different batches. There are different certificates that you will see on the supplement bottles, like NSF or USP or Consumer Lab, so look for these certifications. Second, always check for how long is that company on the market. Is it for 1 year or is it for 40 years? Because being on the supplement market for many years says something. They must do something right. I will put some links in the description of this video for products that meet this criteria, but please keep in mind, I'm not endorsing this company and I cannot guarantee their effectiveness in your case. And while all of this is important, do not take a supplement just because your friend, your neighbor recommended that. Always talk to your doctor and ask for medical advice. Although you may now understand that there are supplements that can help you with autoimmune diseases, not all supplements are the right ones for you. So here is a video that will teach you everything that you have to know about supplements that are good for arthritis.
Rheumatologistoncall.com